What if I told you that in the next few minutes you'll be able to spot the signs of something most parents miss? Scoliosis. Okay, so you're here because you got that nagging feeling. Maybe your child just started puberty or they're younger, and you've just noticed something. First, let's calm those nerves a little, because scoliosis isn't always as dramatic as those images you see online. It's actually a pretty common condition when the spine curves sideways, often in an S or C shape. But here's the crucial part. It's not just a simple curve. It can involve rotation in the vertebrae, which is why it makes it look twisted. Let me explain why this is so bad. Think of it like this. If you just curve a straight line, it's still flat. But if you twist that line while curving it, you get bumps and unevenness. That's what's happening with the ribs and back muscles. It makes one side appear different from the other. The tricky thing is, scoliosis, especially in its early stages, doesn't cause pain, which is why it goes undetected until it gets much worse and then it's really bad. Which is also why you're here, to catch it early. Alright, let's talk about catching it. The key is to look for asymmetry. Our bodies aren't perfectly symmetrical, but certain differences can be really big red flags. We're going to go through a checklist, and I encourage you to literally check off each one. Alright, so the first thing you want to do is have your child facing away from you, with their feet about shoulder width apart, and make sure their arms are relaxed at their sides. Now, make sure they have their shirt off, and then just take a really good long look at their spine. Here are the 3 things to look for when you're doing this exercise. You want to make sure the shoulder height is right. If one shoulder is higher than the other, even just a little bit, and they say they're standing normally, that could be a big problem. Sometimes it's really subtle, so you have to squint your eyes and really make sure you're doing this right. Now we're going to look at their shoulder blades. That's the big blade in the back. You want to look if one sticks out more than the other. If one does, even just a little, that's a big red flag. Remember to be squinting your eyes, always. These are important to catch, and the little differences are big differences. The last thing to look at is hip unevenness. If one side of their hip appears higher or more prominent than the other one, that's a big red flag as well. And remember to always be looking closely to catch those little differences. Now, the next test that we're going to do is called Adam's forward bend test. This one is really important. If there's one that you're going to do, it's this one. Here's exactly how to do it in detail. Have your child stand with their feet together, knees straight, just like a soldier. Now tell them to slowly bend forward at their waist. You're going to have their arms and head hang just like this. Their back should get down as flat as possible. They should bend all the way down until they're pretty much touching their toes. They could bend their knees a little bit if they need to. Now, you want to make sure your eyes are level with their back. As they bend, carefully observe their back. You want to be looking at the ribcage area, but also their spine. Here's what to check. Are both sides of the ribcage symmetrical? And is their spine going straight down? And as always, remember you're checking for those little differences, because those little differences could actually be scoliosis and could lead to something much worse. So now you've done the at-home checks. That's pretty much it. Maybe your kid is perfectly fine and you just got that heaviness out of your head, or maybe you just noticed some things that could lead to something much worse. Let's go talk about what you should do and what these things mean. Let me just get this clear. If you didn't notice anything in your child, but you had a gut feeling that something's wrong, then listen to this. You should never wait and see what happens. The thing is, most of these mini spinal curves don't actually progress. But if they do, it could lead to something so much worse. Also, the sooner it's caught, the more options you have to fix it. The later it's caught, there could be less and less options, and it can even end up to be something permanent. So I'm not trying to push anyone to go to a doctor or anything, but there is a point that you should probably just consider it. Alright, let's go over exactly what all these things mean. The first case is where everything looks perfectly symmetrical or almost perfect. If you've done all the right steps and you're sure you did it right, checking the shoulders, hips, shoulder blades, and especially the Adam's bend test, and everything still looks pretty even, that's fantastic news and means your child probably doesn't have scoliosis. So good job. However, if you notice something like a slightly higher shoulder, but everything else, especially the bend test, was pretty fine, then here's exactly what that means. This is probably coming from postural habits, meaning they're not standing correctly, muscle imbalances, meaning their muscles aren't exactly equal on both sides. The thing is, if it's just the shoulder that's lifted up a little bit, but everything else is pretty much fine, that's not much of a concern. So I wouldn't be too worried with that. And bodies are pretty adaptable, so that can be fixable with some habits. Now let's talk about what if you see a rib hump, like one of the ribs are sticking out from side to side. I mean, when you did the bend test, you looked at the back, their spine was actually uneven and the ribs were sticking out. Even if it's small, that's a pretty big sign of scoliosis, because that was the one that we had to pay really big attention to. Remember, the scoliosis isn't just a side bend, it's a rotation of the vertebrae. This happens because when the spine rotates, it pulls the ribs along with it, making one side of the back appear prominent or higher than the other, especially when they bend forward, which is why we did that test. Think of it like this. Imagine you dip your towel in water and you're squeezing it out. When you twist it, some parts end up thicker than other areas. That's exactly what's happening here, just in your spine. In simple version, of course. It's obviously easy to get anxious if you notice any asymmetry or problems that are uneven, but the most crucial tip is focus on consistency. The thing is, you have to constantly be checking these things every few days, few weeks, especially if you notice signs of bad things at first, because you want to make sure you know what you're looking for. Another condition is when you see your child slouching or standing with bad posture sometimes, and you're probably wondering if that could be a sign of scoliosis, and it absolutely can. So that's something to watch out for too. If you keep noticing that they're having bad posture, then you should keep doing these tests and make sure you're doing the test right to really find those unbalances. Alright, that wraps up pretty much about everything. That's exactly how to find what to look for, and hopefully will help you solve your child's scoliosis if they have it. The thing is, most scoliosis problems go away after time, but the few that do stay can get really bad. So it's always good to try to figure out treatments for it. If you stay posted, I'm going to be posting another video on what to do about scoliosis. Like and subscribe.